This is Paula Murgia signing on for Pixels and Pills here at the ePatient Conference in Philadelphia 2010. Right now I'm here with Phil.
Phil Baumann, Health is Social.
Is that the name of your company?
It's the name of one of the projects that I run, Health is Social, correct.
Fabulous. Phil, you asked a very interesting question at the end of the keynotes that began to inquire as to how do we start to spread technology adoption amongst the healthcare professional group. Given that this conference is all about the e-patient and that the patients are online, can you restate your question and then we'll talk about what the answers were?
Absolutely. So the reason I asked the question is because there's a lot of talk about e-patients, empowered patients, but a lot of the physicians aren't necessarily plugged into this kind of conversation, and physicians have traditionally learned to communicate a certain way. This is kind of how the healthcare system has worked, especially here in the U.S. So the idea is how can we sort of market this idea to physicians to make them realize that this is the trend that patients are going, that patients are no longer passive, that they are active, that they are asking questions. So how can we create an environment for patients and physicians to collaborate with each other? And really the best way to do that is really to get physician involvement, because we can have the patients do all the advocacy and events like this, but if the physicians aren't really traveling with this, then it's really a limiting agent. So that was why I asked the question.
Which is very endemic of how the situation is playing out in the doctor's office. So one of the answers to your question was talking about, the keynotes were talking about the Robert Wood Johnson Open Notes Project. And then one of our other keynote speakers actually mentioned that EMRs and EHRs in the incentive for doctors to adopt those systems could potentially be the bridge to engaging a patient. But right now, how do you feel about the current state of EMRs and EHRs that seem to be closed to the physician network?
Well, right, and there's a whole issue of EMRs and PHRs, and it's going to be a while till we get everything standardized, or at least create federations where everything can have interoperability. But going beyond that and assuming that we get basic EMR done, that was an interesting answer regard to EMR sort of being in the center of getting to patient engagement, because I could envision the electronic medical records are right in the workflows of physicians. So that, physicians really can't go outside their workflow. So if you can get into their workflow, that makes a lot of sense. And I can see with a lot of these social software, I can eventually see adding layer, you might call it social components, social features, so that physicians can collaborate with each other and then make it a lot easier to engage patients. And like one of the quotes from that reply was, take this URL and call me in the morning. And that sort of sums up the idea.
Thank you very much, Phil. We're going to sign off now.